my name is Taeho Lee. I'm your local chiropractor here in Chiro and Acupuncture Clinic. And today we're going to talk about shoulder pain. So we're going to talk about what's really causing the shoulder pain and how it's gonna impact your life, and also how to help the shoulder pain. So most of the shoulder patients I've seen, they have a common problem is that they have a pinched nerve in the neck. So what that means is there is nerve coming out from the neck, and this nerve from the neck and goes to the shoulder. So what that does is that the dysfunction of the nerve make all the muscle around the shoulder, it make it tight and weaker. And also when our posture and the neck is getting tight, our posture, going like head forward posture, then what happens is the shoulder become round shoulder. Then from that the humor in that shoulder socket is coming down, that affects all the muscles around the shoulder. So the first most important thing is about your neck muscle and tensions has to be relieved. So in here in the neck, and we have those SCM muscle, and go like right in behind the SCM muscle. When you like touch it, a lot of times some people who have a shoulder pain, and this area is very, very tight. So you can go around behind that and release like this muscle, and you can hold this muscle and turn your head to the left, like this, and go back, and also turn your head to the left. At the same time, the hands is pulling down, and this one, your head goes back and forth, like this, back and forth. Same thing in here, right behind the SCM, go hold that, and go back and forth, go back and forth. And also there is another scalene muscle which is in front of a SCM, and hold it, and this one goes like this, go down and look to the same side shoulder, go down, look, and look back to the shoulder. Same way in here, touch that, go down, look at the same side shoulder in the back. So that will help to relieve a lot of tension in that muscle. Once this muscle is more loose, then all this muscle will become like not as tight and things like that. So most important thing is your neck. And also those are muscle in the scalene and attached to our collarbone. So there are 3 attachments. One is the middle of the collarbone, and where the chest, the sternum meets, and in the middle, and the inside, middle, and outside. So all those areas below the collarbone, and do massage. And also do those massage. And so massage the area, so those things can lose. So all those like tightness, the neck, goes more like tight, that affects around the area to shoulder. So it depends on which area of the muscle. It affects the impact the range of motion, the shoulder, your arms going forward like this, or sideways, and backways. So in here, and also one of the second most important muscle in the shoulder is a deltoid. In here, the deltoid, go around in here. So this muscle. So in here, on the outside, the deltoid in here, front and back. So all those, find out where that most of the tightness area, and start to do like find that area and start to do like rub it and release those knots, like tightness, like work on that tightness. So the deltoid, so from the more inside, the outside, and more in the back, so 3 areas to release the knots. And then the next most important thing is like biceps. So bicep tendons attached to in the shoulder joints, and many times have a bursitis, causing the bursitis and inflammation and tendinitis. And then when you go around that from front, go around like this, then you can feel some like tightness, kind of a muscle fiber. So on that area, and that release, those things, push it and rub it, and keep doing it until you feel the release. So the deltoid, the biceps, and the scalenus in the neck is very important for the shoulder. And also another important muscle is the supraspinatus. So supraspinatus helps that lift your shoulder. So when this one is like tight, it's hard to like lift the shoulder. So there is on the top of the shoulder. So you feel some bone structure in the back, in the scapula. Then on top of it, there's a muscle. Those are the supraspinatus. So same way, in the middle of those muscle, find that those knots, and working on it, and outside, and more towards the shoulder joints, and get rid of all the points. And after that, see if you feel much like your shoulder is much really free, and about 60% of people, about this much, they start to feel much loosened up and things like that. And also some other muscles like the triceps and triceps in here, so loosen up in the triceps in the back. Like that. So when you have shoulder pain, it is sometimes people who sleeping the side sleep. It is very difficult to sleep in the side, and also something you lifting something and reach out, or changing clothes. It could be pretty painful. And then also some exercise you can do at home is loosen up the shoulder joints, and also around the muscle in here too, because when our neck is tight, our shoulder joint become more round like this. So we want it more in the back and extend. So hold, go like this,
like that, and go back and feel like all the scapula bones meeting back in the back, and go like this, and go like this, and also going like this. So do this exercise about like 12 times, and 2 times a day. That will help you like more. Your shoulders feel like more extended, and then to feel like more have a good posture. And also any other exercise like holding, like moving the shoulder rotation, going like this, and going backward. All those things will help the more range of motion, improving the more blood circulation in the shoulder joint. That will help free up and more tightness, and help get more blood flow, and your shoulder pain will get better. Thank you.